Hi, welcome back. So now we're going to talk about the different studies my group and I discussed while researching postpartum depression. So one of the first studies we looked at was one that involved about 2,300 mothers, and basically it was looking to find out the prevalence or how often postpartum depression occurred, and also how effective prenatal education and screening at delivery could be effective in the treatment of potentially depressed mothers. So the experimental group received prenatal education and were given a postnatal depression scale immediately after delivery, and then somewhere between 2 to 8 months following that. And basically, what this study concluded was that effective education and accurate diagnosing was greatly indicated for the treatment of these depressed mothers. Okay, so the second case we looked at was a pilot study of an exploratory analysis of a larger study, and within a little bubble, it was a double-blind randomized clinical trial. So basically, this study looked to see if the use of pharmacological antidepressant would be effective in treating postpartum depression. And a multitude of scales were used in this study just to give a different clinical picture of the different symptoms for each mother. And some of the tools used were the Global Assessment Scale, the Gratification Mother Role Scale, the Infant Care Scale. Inclusive criteria for this one was they had to be between 15 and 45 years of age with a diagnosis of major depressive disorder. And the study concluded with that the usage of two antidepressants in combating depressive symptoms in postpartum mothers was effective, and it also improved the gratification within the maternal role of these diagnosed women. Okay. Another study we looked at, um, the purpose of that study was to assess the effectiveness of psychological and psychosocial interventions in decreasing the symptomology of PPD or postpartum depression, and how effective those those psychosocial interventions can be. It was 9 randomized clinical trials of 956 mothers, and this study concluded with that any type of intervention, educational interventions such as support groups and family education, reduce the symptoms of depression within those mothers. And lastly, another article we looked at was conducted to assess the effectiveness of the health locus of control of pregnant women. And basically, they were given a tool, just explaining, I guess, looking at the external locus of control, or things that outside of an individual's control affecting your life, and also the internal locus of control, which is what you can control, what you think that you can control. So it's a pre-post experimental design. So the women took the depression scale and the multidimensional health locus of control assessment tool. Then they were given education, and so were their spouses and or loved ones. And then they took the depression scale and the multidimensional locus of control again. So what came out was that although the external locus of control didn't seem to have any differences, the internal locus of control, so having that education and the ability to recognize those symptoms, that increased, and the incidence of depression was decreased within that experimental group. So with those studies and also other ones that we looked at, some sort of intervention is needed, and usually those interventions didn't even have minute improvement. The improvement was pretty large and pretty apparent. Okay.